I'm Dr. Rachel Fisher, and I'm a consultant dermatologist. Well, I was quite academic at school and enjoyed the sciences, and I also had a fairly I had some medical exposure with my father, having been an ENT surgeon. He was quite an inspiration to me. But I think being a doctor was probably influenced mostly when I had a period when I wasn't very well as a teenager and had been in hospital for a time and saw the amazing work that doctors and nurses and the whole team did, and that cemented my decision to then go to medical school. I'm quite a perfectionist and like small detail, and dermatology is often about the small detail. It's a specialist subject rather than a more generalist area, which suits me better. And it's also vastly varied. So I deal with both adults and children, which is rare in secondary care. And I am a physician, but I'm also able to practically use other skills and operate, which means that my day-to-day job is interesting and I'm constantly learning. So it is a really vast specialty, dermatology. Unlike some other areas of medicine, in dermatology, we have thousands of different diagnoses. And my job as a dermatologist is to try and work out what the diagnosis is for the patient and then the best treatment. So actually, it's very rewarding for me to be able to know the specialty well enough to make the diagnosis, and therefore really rewarding for the patients to finally often get a diagnosis they've been searching for a long time, and then we can move forward with treatment. Dermatology also affects a huge proportion of the population at any one time, and often has a big impact on patients' lives that isn't always recognised. And I feel that as a dermatologist, I'm able to recognise these and help patients to get better and improve their skin. So with the first point, so what do they value most about me? I would say I'm extremely thorough. Again, I mentioned about liking detail, so I tend to go into quite a lot of detail. And that involves me really listening to patients. So I spend time hearing the story and hearing what somebody has to say before then asking some specific questions to try and narrow things down and get to the bottom of it. And I give patients time, but I also really involve them in decision making. So we'll often discuss the different treatment options and even investigation options, and we work together to get the best outcome. With regards to what I value most about patients, again, I think I value that patients are all individuals, and that sort of goes along with what I said before, in that when I see somebody, it's about a partnership and it's working together. So I can try and help and can try and get the information and do investigations to find out what's going on, and I need the patient to then also sometimes work with me, and so it's a two-way process where we can try and get the best treatment for that patient.